In terms of sex or having sex with your partner, in men, we know that certain positions might put you at higher risk for getting like a penile fracture or an injury related to sex. Are there certain maybe positions, locations, speeds of sexual encounters that may put women at higher risk for getting maybe vaginal lacerations or injuries?
Yeah, so, not that there's a specific position per se, but sometimes like speed and like friction, like if you don't have sufficient lubrication, like that's where people will say like, oh, it really burned afterwards or it really hurt during. Again, just everything's different for every person. So if you know that there are certain positions for you that are, it hurts because, like the angle of thrusting is like too much for you, like just let your partner know. Because even if, say like your partner has never had an issue with that particular position with any other partners, but it hurts you, that's enough. You can say like, ouch, that hurts. Let's not do that one anymore. Or if there are certain positions that hurt you all the time and it's unusual, then actually talk to your gynecologist, because it could be something like endometriosis. It could be something like pelvic floor spasm. There's certain muscles that when you hit them, it can be, they can seize up and hurt. It's definitely not side of like a universal, like there's something like, was it reverse cowgirl that can cause more risk of penile fractures? There isn't such a thing, I think, for women. But if there are certain things that you're like, oh, wow, that is unusually painful, then, talk to your gynecologist, because there could actually be something that could be treated.
I saw in one of your videos that a woman like literally had a vaginal laceration due to going down a water slide.
Yes. Yeah, that story shocked me because, I was trying to imagine like the force that must have occurred, because it was quite a bad, it wasn't just like a little one. It was like internal laceration, like her bowel, I think, got affected. So the important message with that is that anything at high speed can injure the genitals. And so it was like water sports, like if you were like water skiing, you were jumping off of something into the water, like anything at high force can cause like shearing injuries of the labia. The water can go up the vagina or the rectum, less likely the rectum, but it can cause, injuries by being forced up the vagina really fast. And I was really surprised because I posted that. And then a couple of gynecologists like, yeah, like I used to work near a water park and I saw like vaginal injuries from water slides. I know. So, important takeaway. When they tell you on those slides for safety, cross your legs, across your ankles, try to do that. If you're concerned about it, don't go on it. And people are saying, oh, maybe you can like wear like kind of like those bathing suits with like the leg portions. Like you could do that. Then there's no way for the water to get up. But anyway, so I was very surprised about that. When you live in, you do this long enough and you're like, wow, I hadn't heard that before, but good to know that that is not an infrequent cause of injuries. So
do people lose things in the vagina like men put things in their
they can.
Urethra and rectum?
Yeah. I think it's not as common. Like, we always hear about things going up the urethra or up the rectum. People definitely put things in the vagina, and it's kind of similar like with the rectum. Like if there's the suction, you can't break the suction and you can't get it back because there's no like flared base. It can go beyond where people can reach it and pull it out. So I've removed things in the ER, sometimes even the OR under sedation, where people were masturbating, something got stuck in there and they just couldn't break the suction to pull it back down. There's nothing embarrassing about it. It happens. It definitely happens. I think it's not as publicly known about as, say, foreign bodies in the rectum or the urethra, but yeah.
Yeah, so use things with a handle or a flared base so you
Absolutely.
can get it out.
Exactly. Yes.
Because even though it's not shameful, it is something that requires a trip to the ER, which is not great.
Exactly. I was supposed to say it's just an inconvenience you don't want to have. And it's a little bit easier with the vagina because it's obviously shorter than, the rectum, the urethra. Things can go farther in, kind of beyond your reach. But they can get stuck in there, so just avoid it altogether. Things with the flared base or a handle.
The other big myth on social media is that the number of partners you have, the amount of semen that is going into your vagina may affect, I don't know, your microbiome, your immunity. Like, I don't know, a whole bunch of things have come up. So is there any truth to any of that?
So things like the yoni stuff or so I always tell people, number one, you just don't need it. Like there's no kind of medical need for it. Like I've seen a lot where like you need to purify things with like yoni steams and that sort of thing. You don't need it. In general, like say if you're using toys, like so, toys and stuff, as long as you keep them clean, like you wash them between partners, like it's totally fine. The other point too, like, when we were talking about foreign bodies, not counting obviously like vibrators and devices, because those are long enough. They're intended to be used. You can hold on to them. They're not going going to get lost. But as long as you're using stuff and can cleaning them, sex toys wise, between using them with different partners, it's fine. I've heard of things like people putting like garlic in the vagina. Don't do that. If it's going to maybe have bacteria from the earth, don't put that in there. But
yeah. I think also people worry like if a female has had too many partners.
Oh gosh, yeah.
She may have some changes to her vagina.
I see. Yeah.
Obviously, I've talked about this many times on my channel where it does not affect the vaginal laxity or width or length of the vagina. But in terms of like the microbiome, is it going to change things for the female if she's having a lot of sexual partners?
No, it shouldn't. And so this is something that is so important, kind of just it's always on TikTok. I don't know why. Like people are so obsessed with this that like there's something that changes irrevocably about your body when you have, multiple partners. First it was like that you can tell by how loose someone is, like literally how physically loose the vagina is. No. And I've made videos about this before. How would it know like that you're having sex with one person 100 times or 100 people one time? There's no way to tell.
Yeah.
It's not going to be like, okay, now it's going to be looser because it's different people. And then in terms of the microbiome, it shouldn't. Now that being said, sometimes people do notice, and this is not even just with different partners, but with say like the same partner, that they may get, BV or yeast infections after they have sex. Like that's not because of something to do with the partner. It's just, moisture. Like sometimes just, moisture like from semen can cause things like a little bit of a vaginitis. So it isn't something to be just, oh my God, I can never have sex with my partner again. But just, to be aware, like maybe don't say use panty liners right after because it holds the moisture there. There's certain things that you can do to try and prevent that sort of thing. Or if you really are getting recurrent infections, we can do things to prevent them. Like you can take medication to prevent yeast and bacterial BV infections. So definitely it shouldn't be something that you should be like, oh, I can't have more partners even though I want to because it's going to ruin my microbiome. No, you can have sex, and as long as you're protecting yourselves against STIs, that's the most important thing.
Is there any post-sex hygiene or post-sex rituals, whether or not someone's having recurrent infections, but also if someone is, that people should do?
Nothing special, just as long as just kind of clean up however is convenient for you. There's also, again, people have like marketed like these special sponges and things you have to put in the vagina.
If you're not watching, I just had a real eye roll.
Our eyes both just rolled back. Like anytime there's these products that, again, people create a market for product that there's no need for it, but they generate a need. You don't need any special devices or tools or sponges or anything like that. Just, once the semen comes out, just wipe it away, towel, tissue, whatever you need, take a shower. But that's it. Again, you don't have to wash inside. You don't have to worry about the semen. It will just come out with gravity.
So we end our podcast. Well, before we go to those final questions, is there something that you feel like we haven't covered that my audience is largely male, that they should know about gynecologic health that would help them be better partners, better fathers, better brothers, better sons?
Oh my God, I love that. And so I think just talking openly about it, so much of these issues, and this is like what's great about your podcast and your YouTube channel, is just talking openly about these things. Like they're not shameful, they're not embarrassing. You shouldn't feel like you have to kind of keep things hidden. And that should include, talking with your partner, periods, sexual health, vaginal health, bladder stuff. All of it is things that you should feel comfortable discussing. And I hear this a lot, even from people who are like, oh my gosh, like even my elementary school kids, they're like, ew, like, periods, vagina's gross. Like from such an early age, like people absorb that message that, it's embarrassing, like keep it hidden, don't talk about it. And I think just being able to be open in communication with your partner about what she's going through with her sexual and reproductive health is so key, and feeling supported. So if you see that your partner is, every time that she's having her period, she's in so much pain, or she's like, bleeding all over the place, she's having to buy a million tampons, just to kind of encourage you, be like, it doesn't seem right. Like, I maybe you should see your gynecologist, like, we'll get you help. If she's having pain with sex, she seems clearly uncomfortable when you're doing certain things, just stop and just be like, are you okay? Like, is that painful? Like, what's going on? And just to have that ability to talk freely about it, that's key. And that's why I was saying, I lit up when you said that your listeners or your viewers are helping their partners get care. I'm like, that's fantastic. So, with my book and with the videos, I always say it's not just for women. Like people say, oh, every woman should read this. I'm like, no, like everybody should read this, because it's important for all of us to know. Like all of us should know about things like, like how to have a satisfying sex life, how to, like to take care of your fertility, to avoid pregnancy if you don't want to be pregnant, how to live your life in menopause and midlife. So, thank you to all your viewers and listeners who are, they're part of that. Like they're being good partners, they're good, but being good husbands and siblings, sons, like everything. So thank you.
Yeah. You're welcome. Thank you. I think it's important also to talk to your kids about these changes.
Yes.
So I have sons, but I've told them, like actually my son asked me about periods and I said, yeah, this is something that happens. It's totally normal. And I would just ask you that if you ever see a girl struggling in school, like please, even if other kids are making fun of her or whatever, kids they don't know anything. And I was like, just be polite, be kind. Like it's very hard. It's very different. It's a challenge for them. And it's going to happen every month, right? And so I think it's important to teach your kids what's going on with their bodies and what to expect. And even your sons, right?
Yeah.
They should know what's going on with their female friends and potentially girlfriends and whatever, right?
Yeah, exactly. And things like, consent, objectifying people, like, young kids, like they may make someone, like their breasts are developing, they may make fun of them and that girl may end up feeling that shame about her body. Or like I said, when you're being sexually active, some of your viewers are very young, they're maybe just starting to become sexually active, getting consent, talking about it, like not just making assumptions about, somebody wanting to be sexually. So just being able to be mature enough to talk freely and openly and in a non-shaming way.
If you enjoyed this clip from the Rena Malik MD podcast with Dr. Karen Tang, make sure to check out the full episode right here.